Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. If you have symptoms like tiredness, decreased libido, and a lot of facial hair or acne, then your doctor may have advised a free testosterone blood test. And today I'm going to tell you everything that you need to know about this test. So, what is free testosterone? Now, you may have heard of testosterone as a hormone which is required in men for muscle development and so on. But testosterone is required both in men and in women for proper development and growth of secondary sexual characteristics, puberty, and more. It is also important for maintaining your mood and libido. But there are two types of testosterone. One is the type of testosterone that is called the total testosterone, and that is generally bound to certain proteins in your blood. So, it's not available for your tissues to use directly. There is a very small fraction of the testosterone which is not bound to anything. It's free. In fact, that is the component that acts on your tissues and causes your muscle development and hair growth and so on and so forth. That is called the free or active testosterone, and that is what this test measures. Now, what are some symptoms that could give you a clue that you actually need this test? So, some of the common symptoms that we find both in men and women are fatigue and tiredness. You feel tired all the time, you may feel depressed. Your muscles are weak, you feel weakness in your muscles, you don't feel strong. Reduced libido, that's another very common thing that we find in both genders. Erectile dysfunction, something very commonly seen in men whose testosterone and free testosterone levels are low. In women, you're going to have problems like excessive facial hair if this level is too high, acne all over your face, maybe also on your body, menstrual irregularities, that's very common in both gender, especially in women. Menstrual irregularities are maybe the first sign that we see when the testosterone level or the free testosterone level is too high, and mood changes is something you will see in both genders. So these are some of the symptoms that suggest there's something wrong with your free testosterone level. What would a doctor think when he's advising this test? Why would a doctor even advise this test? So the first and most important reason to do this test is to evaluate whether your testicles in a man or your ovaries in a woman are actually working properly. Now, these are the organs that are responsible to create the sperms in the men and to release the eggs in women, and this is the most important thing for fertility. So checking whether your testicles or ovaries are working properly, and consequently what could be the cause of infertility if you are a couple who is trying and unable to conceive. The next thing, especially and focused in women, is something called PCOS, where there are very high levels of these male androgens like free testosterone or total testosterone in your blood. This test is also advised to check whether this syndrome is there in your body. Other than this, mood changes and unexplained symptoms are also some of the common reasons why a doctor might advise these tests, this particular test to check your total androgen level. How do you get this test done? If you plan to have this free testosterone test, here are some things that you need to remember. It is advisable that you should be fasting, that means no food, for 8 to 12 hours before you provide your blood sample. The test is done like any other blood test. They will insert a needle into the vein in your arm and collect a few ml of your blood and process them in the lab. It is recommended that you provide the sample between 7 to 10 in the morning. This is because there are changes during the day in the level of free testosterone. The sample that is drawn is a simple blood sample. Some things that might interfere with the results are if you're taking any kind of hormone replacement therapy, if you're already on steroid medications, you must tell your lab about this, and the results will be available almost on the same day or maybe on the next day in most labs. What is important to remember is that free testosterone is generally an expensive test because it requires very special processing, so you need to ask your lab about the cost. What are the normal ranges of free testosterone in adult men and women? I've included a set of normal ranges over here. What you need to remember is that the values are much higher in men, and free testosterone accounts for nearly 3% of the total testosterone that is available in men and just around 0.7% in women. You can take a look at the normal ranges on this page. What are some causes of abnormally high free testosterone levels? Well, in both men and women, the causes are as follows. Early puberty, a situation in which boys or even girls attain puberty much earlier than normal, is usually associated with a higher level of free testosterone. Secondly, you could also be showing a high level of free testosterone because of an overgrowth or a large lump in your adrenal glands. These are two tiny little glands present above each of your kidneys, and there's a condition called congenital adrenal hyperplasia which causes an overgrowth of these glands. There could also be a situation where there is a cancers in maybe in the ovaries, even in the adrenals, anywhere could cause a higher than normal level of testosterone, free testosterone. In women, a higher than normal level of free testosterone can also be seen because of PCOS or PCOD, which is a situation with which has a much higher level of male hormones in women. And in men, we have this. We also see this in men who do steroid abuse. They take too many anabolic steroids to develop their bodies or their muscles. We also see a very high level of free testosterone in those cases. Now, if your free testosterone level is much lower than normal, what could be some of the causes? Well, obesity, that means being overweight, having thyroid problems, or even having diabetes. All these three things can reduce your free testosterone level. These are what we call lifestyle reasons, and they're becoming more and more common with time. Other than this, in both genders, if there is some kind of a problem with the pituitary gland in your brain, because that is responsible to control the levels of various hormones in your blood, that can also give rise to a lower than normal free testosterone level. For example, if you had some kind of an injury to your head, you've had an infection, maybe you have a growth in the pituitary gland, there are many possibilities because of which this pituitary gland doesn't work properly and your free testosterone level drops. In men, there can also be something called testicular failure, where the testes are not developed properly or they don't work properly, and so they don't make enough of testosterone. Similarly, in women, there is something called ovarian failure, where the ovaries don't work properly or they're not developed, and that can cause reduced levels of these of free testosterone.